So, I'm willing to bet that most of you have heard of personality disorders such as borderline, narcissistic, or obsessive compulsive disorder. But maybe you haven't heard of histrionic personality disorder. So, where does this word histrionic come from? Well, it comes from the Latin word histrio, which meant actor, and then in the 17th century it came to mean hypocritical or theatrically exaggerated. But this raises the question, what exactly is histrionic personality disorder? And what are the consequences for people who are diagnosed with it? And also, what are the subtleties and differences with the other aforementioned personality disorders? Well, today we're going to try and enlighten you on this question. So first we'll see in depth what histrionic personality disorder is. Then we'll see the consequences on the individual. And then finally, before concluding, we'll see these links and differences with other personality disorders.
So, what is a personality disorder? A personality disorder is a class of mental disorders characterized by pathological patterns of behavior. These behaviors can be the consequence of cognitive and emotiveness problems. They are classed in the DSM-5, which is a manual that clusters recognized mental and psychiatric pathologies. Personality disorders settles only in the individual's life. They are inflexible and make part of the deep internal functioning of the individual. Then, a personality disorder is very difficult to treat. Personality disorder's existence is contested by some persons who think that personality disorders are a result of social and cultural aspects of the individual. However, personality disorders are increasingly studied. There are a lot of personality disorders because they are very specific and affect precise traits of the individual. So you probably heard about borderline and narcissistic disorder because they are the famous ones, but histrionic personality is not known as the precedent ones. Histrionic personality disorder is defined as an excessive need for approval and desire to be the center of attention. They are often animated, dramatic, seductive, or flirtatious. They feel relationships are closer than what they may actually be. Histrionic is classed in the cluster B of DSM with antisocial, narcissistic, and borderline personality disorders. Divas, attention seekers, drama king, drama queens, maybe you've met some people like this and called them like that. These people want to be the center of attention, and they will try to pull people into the orbit, rapidly shifting and intense-seeming emotional states. Over time, you'll understand how shallow and out of proportion the emotions are, superficial expression of emotion rather than a real genuine feeling. Histrionic people use their physical appearance to be the center of attention and manipulate people, being overly flirtatious and seductive in situations where it's not required. They lack of filter from appropriate and inappropriate situations. The want for attention trumps social norms. They are easily swayed by others' opinion, and they believe their attachments to others are stronger than they actually are. Their communication style is style over substance. They say a lot in a dramatic way, but the inherent message of what they say is difficult to pinpoint because of their very theatrical way of presenting themselves. Women are more often diagnosed with it. This maybe has to do with social norms allowing women to express these traits more openly than men have historically been allowed to do. So next I'm going to give 8 different criteria that describe the histrionic personality disorder. First, they are uncomfortable in situations where they are not the center of attention. They are overly seductive or they have provocative behaviors. They are rapidly shifting and shallow expressions of emotions. They use physical appearance to stand out and draw attention. Their speech lacks in detail and focuses on being dramatic. They have exaggerated expressions of emotion. For example, they are talking loud, they are jumping, or they are banging. They are easily influenced by others too. And they think that relationships are more intimate than they actually are.
So I will present you the causes and consequences of HPD. First, the causes. The first cause is the genetic one. As psychiatric disorders tend to run in the families, when it does, whether it be personality or substance abuse disorder, it may increase the risk of developing HPD. The second one is the neurological cause. Studies have shown that there is a strong correlation between the functionality of neurotransmitters and the cluster B personality disorders such as HPD. And the third cause is the psychological and environmental factors. First, the childhood trauma can have an impact on HPD, on the development of HPD. So what can happen is that what has started as a way to deal and adapt to the trauma can then develop into a full-fledged disorder if not addressed early on. Then there are also some parenting styles that may contribute to the development of HPD, such as overindulgence, inconsistent behaviors, and no appropriate boundaries set, as well as traumatic tendencies and abnormal sexual behaviors. Now we will talk about the differentiation between men and women. So in recent statistics, it appears that women are touched by this or diagnosed with this disorder 4 times as frequently as men. However, some argue that these numbers could be explained by the fact that attention-seeking behaviors and sexual forwardness are less socially acceptable for women than for men. Therefore, some doctors believe that there are more men touched by this disorder than are diagnosed. There is also another theory, which is that women touched by HPD tend to associate it with antisocial personality disorder, which will be explained later on by Tina, whereas men tend to associate it with somatic symptoms disorder, SSD. And you may know the latter under the name of hypochondriasis, as there used to be a differentiation made between the different types of SSD, such as somatic disorder, somatization disorder, hypochondriasis, and many others. But what they all have in common is the expression of mental phenomena as physical symptoms. So we will now go on to the consequences and treatments for HPD. So histrionic people tend to see their relationships as deeper and more intimate than they really are, and this can have 2 repercussions. First, they may expect from the other more than they are ready to give at this stage of the relationship. And secondly, when this relationship ends, they tend to experience light or major depression symptoms due to this over-attachment. And these depression symptoms are often what will push them to seek therapy. However, very little is known about the efficiency of cognitive behavioral therapy and drug therapy for HPD. So for now, the most recommended therapy for histrionic people is the psychodynamic psychotherapy. Even though it is still challenging, given that they may exaggerate their symptoms and are often emotionally needy, and thus straining the relationship, the boundaries, behavioral boundaries set by the therapist. But now, what exactly is psychodynamic psychotherapy? Well, it focuses on underlying conflicts and in-depth talks in order to relieve psychic tensions. It interprets and tries to understand and find patterns in the individual's mental and emotional processes for them to understand themselves and how they function better.
So HPD is similar to other personality disorders, but it does have distinct traits that set it apart from the rest. So first of all, there are 10 personality disorders split into 3 clusters. So you have A, B and C. And histrionic personality disorder, along with antisocial, borderline and narcissistic disorder, is part of cluster B, or the dramatic, erratic and emotional category. So what are the differences between HPD and its neighbouring disorders? Well, first of all, with antisocial personality disorder, people are charming and manipulative, They have a disregard for moral values and norms. They have poor impulse control and are prone to aggressive and unlawful behaviour. This is often characterised as psychopathic or sociopathic behaviour, and with HPD they only have the manipulative and poor impulse control traits in common with this. So next, narcissistic disorder. So with this, sufferers tend to have a very grandiose image of self. They think they're the best and they want to be recognised that way by everyone. So they have a very vulnerable sense of self and they can lash out at the slightest criticism. They do lack empathy usually, like in antisocial disorder in fact. And we can see that they seek attention clearly, but it's not the same as in HPD, because in HPD they don't mind what kind of attention they receive, if it's cute or silly, whereas narcissistic sufferers seek attention that elevates them. So also with histrionic people, they aren't oblivious to other people's feelings because they're constantly analysing how other people feel about them, contrary to narcissists. And then thirdly, we have borderline disorder. So people with borderline disorder tend to have unstable emotions ranging from intense joys to intense rage the next. They also have symptoms such as constant anger, feelings of emptiness, paranoia, an intense fear of abandonment, and even suicidal behaviour, sadly. So both HPD and borderline sufferers have intense emotions and also a tendency to be manipulative and the attention-seeking behaviour. But only borderline patients have the identity disturbance, the constant anger, the feelings of emptiness, and the self-destructive behaviour. Whereas on the other hand, only histrionic people are suggestible, have an impressionistic style of speech, and inappropriate, seductive and provocative behaviour. So patients with borderline personality disorder often consider themselves as bad, and the emotions they feel are very deep and real, whereas histrionic patients don't consider themselves bad, and the emotions that they experience aren't actually very deep, they're just superficial. So we can see that there are some clear differences between these. And in this cluster, the cluster B, there is a high rate of comorbidity, which means that patients may have borderline and histrionic disorder or antisocial and narcissistic disorder. So some professionals don't believe that histrionic personality disorder exists. They think that it's a variant of borderline. And then there's also professionals that don't believe in personality disorders at all, such as our clinical psychology teacher, who believes that they're just traits that are among everyone. But others do strongly assert that this definitely does exist.
So there are many known personality disorders. HPD is just one of them. And as we have just seen, they all have strong consequences on the individual's life, psyche, relationships, and behaviours. Understanding them all and trying to cure them all in order for them to come back to this so-called normality would be illusionary. So what can we do, concretely? Well, I guess you all have already felt out of place, strange, abnormal, or even different. Well, we could remember those moments and the fact that some people may feel more different, more abnormal, stranger than us. And we could also remember that sometimes for these people we are the strange ones, so we might as well be more tolerant and accepting.